Doctor, how is it too that you diagnose that someone even has these allergies? I mean, I think a lot of people maybe once in a while they are sneezing, having some of those other symptoms that you talked about, but how do you actually diagnose when someone has allergies?
So allergies are really clinically suspected. So a lot of times based on the history and the physical, you'll kind of get the sense, this repetitive trend to see these symptoms and not be related to a fever or an actual, cold or anything. A lot of times people will say, I feel okay, I just keep getting these recurrent symptoms. So that'll be kind of the hint. And then you don't necessarily have to do a lot of testing. A lot of times we'll just treat somebody with medications that are appropriate for allergies, but sometimes it is a good idea in certain situations and depending upon how severe the symptoms are to actually get more testing done.
Okay, and actually just on a personal note there, I did suffer from a lot of allergies younger, and they did those tests that you mentioned. So talk a little bit about those tests. I had those sticks, if you will, put in my arm to see kind of what I reacted to. Unfortunately, my arm was one big balloon by the time they were done, but why are those tests necessary, and how do they help you diagnose what's going on?
Right, so sometimes those are a good ancillary thing, especially if someone's having, like I said, more frequent severe symptoms. So you can do skin testing, or you can do also blood testing, and both of them will help to identify maybe more specific triggers for the allergies. So for some people, like I said, it could be environmental. For other people, it could be anything as simple as medications. It could be pet dander, or even finding out if they're related, if they're very severely allergic to bee stings and other things like that. So in some situations, it can really be helpful to help determine how severe the symptoms could be and what kind of treatment will be necessary.